Welcome to tonight's video chat discussing updates about the COVID-19 vaccines and IBD. My name is Catherine Soto, and I'm the Senior Director of Patient Education and Support for the Crohn's and Colitis Foundation. We've received a lot of questions since our last Facebook Live chat about the COVID-19 vaccines. And we thought that with the recent U.S.'s FDA issuing emergency use authorization for the Johnson & Johnson vaccine, it's time for us to provide an update about what IBD patients need to know about the vaccines, as well as provide information about the CDC's recent mask recommendations and more. Over the next 45 minutes or so, Dr. Meena Bewtra from the University of Pennsylvania Medicine will answer your questions about the COVID-19 vaccines and IBD. So Dr. Bewtra, I'm so pleased and honored to have you here tonight. Thanks for joining us.
Thank you so much. Really, the honor is all mine. Thanks so much for the invitation.
So before we get started, a few pieces of housekeeping. The information provided during tonight's chat is meant for educational purposes only. It should not replace any advice you receive from your healthcare team. So if you have questions about your specific care, please reach out to your healthcare provider. Tonight's chat is going to be focused on the COVID-19 vaccines and IBD. So if you have other questions regarding IBD, we won't be able to get to them tonight, but please know that we have an IBD Help Center available to help. And you can email us at info@crohnscolitisfoundation.org or call 1-888-MY-GUT-PAIN with any questions you may have. So we want to give a big thank you to the sponsors of the Foundation's COVID-19 Resource Center. That includes AbbVie, Genentech, Gilead Sciences, Janssen Pharmaceuticals, Medtronic, the Pfizer Foundation, and Takeda Pharmaceuticals. Additional support is provided through the Foundation's annual giving program. And lastly, if you are watching, please comment below and let us know who you are and where you're from. With all of that out of the way, let's jump right in. So, Dr. Bewtra, the FDA recently gave emergency use approval for a viral vector vaccine from Johnson & Johnson. So can you tell us, how does the vaccine work and how does it differ from the Pfizer and Moderna mRNA vaccine?
So this is, I think, a very, very important question, and one I have received a lot of, so thanks. It's a great question. So I just want to start by, hopefully people are familiar now with the mRNA vaccines, but essentially mRNA are like little Post-it notes. This is how I describe it to my patients, that tell the cell what to do. And the Pfizer and the Moderna mRNA vaccines tell the body to make these antibodies to the spike protein, portion part of the SARS-CoV-2 virus that causes COVID. So the J&J vaccine is now using adenovirus, a different type of virus, as a carrier of DNA coding for the spike protein, so that the cells in your body can make antibodies to it. Many people have gotten really worried about this adenovirus component. They worry that this is a live virus vaccine, and maybe they shouldn't get it, especially for our IBD patients who are on immunosuppressants. So I think it's really important to stress from the onset that this adenovirus is not virulent at all. It is not alive. It is not going to be able to cause you to get sick. It is very specifically, it has had its replication ability, the ability for it to replicate, and its survival ability erased from its genome. So it's really just a scaffolding for carrying in this DNA coding, that spike protein, to get your body immunized. There's nothing about it that is dangerous to any of our patients or any of our patients who are on any specific type of medications.
Thanks for that. And so you just said it's not dangerous, but is it safe for IBD patients? And what about pregnant women and children?
So excellent. And I'm going to go through, let's go through each one of those. So first of all, is it safe for our IBD patients? Yes, absolutely. This vaccine, as well as the mRNA vaccines, are safe for our IBD patients. And I get asked a lot, which vaccine is the best one for me? And I'm going to tell you, the best one is the one that's available to you first. Get vaccinated, because that's the best vaccine for you. It's going to protect you. Now, pregnant women and children are two special populations. And so I want to start with pregnant women first. I think it's very important to caveat that none of the vaccine trials included pregnant women. So they, along with children, are classified as vulnerable populations. However, ACOG, that's the American College of Obstetrics and Gynecology, as well as several other women's groups, sort of really lobbied and petitioned hard to the FDA to allow pregnant and lactating women to get these vaccines under the EUA, even though they had not specifically been included in the clinical trials. So it is important to know pregnant women were not included in any of these trials, but at the J&J FDA hearing, which happened, it was a week ago Friday, I think now, the FDA presented all the data they have to date on the mRNA vaccines, the Pfizer and the Moderna vaccines in pregnant women. And to date, they have over 30,000 pregnant women who have gotten these mRNA vaccines. And they have seen absolutely no increased risk of any adverse pregnancy outcomes with the mRNA vaccines. And I think it's also really important for our women, because this is a tough decision, right? This is tough to remember. This is not a zero-sum game. And you can worry about getting the risks of the vaccine, but there are also risks to getting COVID when you're pregnant. And we know that COVID in pregnancy is very dangerous and harmful to not just the pregnant woman, but to the fetus as well. So we are really urging women to talk with their obstetrician during this time. Understand this is a tough decision. It is an individual decision, but the option is there. And so far, the safety looks incredible for the mRNA vaccines. We will get more information with the J&J vaccine as well. They're going to be collecting this prospectively in women who elect to get that vaccine. Next are kids. You know, they are the petri dish of everything. So a very important question. The Pfizer vaccine is approved for children 16 years and older. And for me, an easy way to remember is they can get their driver's license, they can get their mRNA vaccine. Moderna is currently approved for 18 years and older, as is the J&J vaccine. Moderna is currently conducting clinical trials. I think the age cutoff is 12. So if you want to have you can actually go to their website and enroll your kid in a clinical trial if you wanted to for the Moderna vaccine. And J&J indicated at their FDA hearing that they are planning on having a clinical trial as early as like age 1 and up, or even less than 1 and up. So this would be the first early age evaluation of a vaccine. So fingers crossed that we will get this information quickly, because we're all worried about going back to school and our kids going back to school. And it's important to remember kids are not just little adults, they're different. And these trials are necessary, but because we have such great data for the adults, it is possible to accelerate these trials in our children as well and get that data hopefully soon.
And I've seen the data show that the Johnson & Johnson vaccine has a 72% protected, it's effective for 72% in the US. And will patients be as well protected against this getting very, very extremely sick with COVID-19 if they receive this vaccine compared to the others?
Yeah, thank you. So this is the elephant in the room, right? This is the angst that everyone talks about. Is this vaccine as good as the Moderna or the Pfizer vaccine? Because we keep hearing 90 to 95% with Moderna or Pfizer. So let's walk through this a little bit. So during their FDA hearing, J&J presented data that their vaccine was 85% effective against severe COVID-19 globally, 72% against moderate to severe critical COVID in the United States. And I think it's also important to impress that they had absolutely nobody who was vaccinated end up getting hospitalized or die from COVID. I want to repeat that again, because I think that is arguably the most important endpoint here. Nobody who was vaccinated required hospitalization or died from COVID. But these numbers are being compared to the reported clinical trial numbers for Pfizer and Moderna. So it is important to put these numbers in context. The J&J vaccine is only 1 dose. We don't know if you got 2 doses, if this would boost it up into that 90% zone that we had. And also J&J conducted their clinical trial later than Pfizer and Moderna clinical trials. And they conducted them in countries like Brazil, South Africa, Colombia, Peru, Argentina, in addition to the United States. And in these other countries, there is this high prevalence of these variants of COVID-19, including, for example, the South African variant. And yet the J&J vaccine still performed 85% globally. in the Pfizer and Moderna trials, which again happened earlier, those variants were not an issue. So we actually don't know how good the Pfizer and Moderna vaccines would be against these variants right now. So it's really impossible to compare these numbers because it's comparing apples and oranges. And I want to remind folks, I think in all my time that I can remember the efficacy of the flu vaccine, for example, it has never been 70% or higher, ever. And yet we know that it is effective, and we encourage everyone to get it anyway. And that's because of the same reason we're encouraging everyone to get these COVID vaccines, any one of them, because they all prevented hospitalization and death from COVID-19. And that's the end game, right? That's what you want. I don't care how you get there. I just don't want you to die from COVID-19. So take whatever route you need to do to get there to protect yourself and to decrease the spread of this virus.
Thank you for that. I was actually, so you kind of addressed my next question, and I'm gonna give you the answer and you tell me if it's right. With 3 vaccines now available, how do patients know which one they should be taking? And I like your answer before of the best vaccine is the one you can get your hands on. So
yeah, the one that you can get first is the best vaccine for you. And you know, I know people who have been waiting for their turn to get one of the COVID-19 vaccines and have gotten COVID-19. And that's heartbreaking, right? You're trying to do all the right things, but you still get sick. And we know that these variants, at least the UK variant, spread more easily. And that spread offers more opportunity for more SARS-CoV-2 out in the country, and the more opportunity for more variants. So we are literally in a race against time here. We need shots in arms now. And so when you can get the first one you can, you're protecting yourself and you're helping protect everyone around you and your community and all of us. And I'll put this into context. I have a huge extended family, and all of them have different ages, different underlying conditions. They live in different parts of the United States. And all of them have now been offered the Pfizer, the Moderna, or the J&J vaccine. And every one of them have reached out to me and said, should I get it? Should I not get it? What do you think? And my answer, I mean, I should cut and paste this and just save it in my phone. My answer is yes, yes, yes. There's absolutely no contradiction. Please go get that one. That's the right one right now for you because you are eligible for it. I would not recommend something that I thought was unsafe or ineffective for my own family. Yeah.
good to know. Doctor's orders.
Yes.
So at this time and in the future, will a booster be needed for these vaccines at this time and then in the future?
That is a really great question. And I think the answer is very possibly, or maybe a whole new vaccine, right? It may not be a booster. It may be that I need to get a new vaccine. So, and we really, right now, we don't have any idea, but it's entirely possible. It is possible that we will find out that these vaccinations wane over time, and we do have to get that booster. Is it every year? Is it every 5 years? Who knows? Or it could be that maybe we need a new mRNA vaccine because it doesn't work against one of these variants, and that variant has become the predominant strain that's out there, in which case those of us who got one of these early vaccines may have to go and get a second vaccination. And so I would say stay tuned. Science is amazing. I mean, it's incredible how quickly we got to where we are right now. And it's very promising. I heard a podcast with some of the folks who made the Pfizer and worked in the space for the Pfizer and the Moderna vaccine, saying now that we have this mRNA technology, it's kind of like a cassette tape. If the tape isn't right, we can pop out the tape and put in a new one. We could turn around a new vaccine in the span of weeks, because now we've figured out that this is what works. So science is incredible. Stay tuned, stay updated, because I think it's a very good question. It's entirely possible one of those two things may be necessary.
One of the questions we're getting a lot of is in terms of when a patient is scheduled to take an infusion of biologic, what are some of the guidelines they need to follow? Is it okay for them to take the vaccine at the same time as a biologic infusion? What are some of the guidance around the J&J vaccine? Does it differ by any of the other vaccines?
So this is a great question. I'm getting it, I'm sure, a minuscule amount as the foundation is getting. And the correct answer is we don't know yet. We are still learning in the time, but currently what we recommend is that folks just not get their infusions or their injections on the day of their vaccine. And that is simply because we don't want to confuse a reaction to the vaccine with a reaction to one of your medications. But I think this has to be balanced, and I love the CDC's recommendations that this holding off on taking your medications needs to be balanced with the risks of waiting. These are necessary medications, and we really don't want people to have a flare. So what we're recommending is, as long as it's not on the same day, don't wait much longer, you know. We don't have any specific new recommendations for the J&J vaccine just yet, but I would have been making it the same with my patients. Just schedule the vaccine on a day that's not your infusion day, that's not your injection day. And since it's a one-time dose, it makes it a little bit easier. And then I think in terms of other medication guidance, I think some folks had heard, I think it was a podcast or an interview with Dr. Fauci, where he said, well, avoid ibuprofen or NSAIDs or Motrin when you get your vaccination. And, you know, many of our patients don't take those drugs, but I just, you know, I think I tell my patients you can take Tylenol safely and remind them, look, in the clinical trials, they didn't tell people not to take Tylenol or ibuprofen if they were feeling bad. And yes, people can have very sore arms. A vast majority of people get sore arms. Many people will get fatigue or get headaches. And this is more prominent if you're getting the mRNA vaccine with the second vaccination that you get. And so, yes, it's okay for you to take those if you need to. Don't suffer unnecessarily. There's no reason to take those medications in advance, though, because there are also a group of people who go through it fine and they feel fine. I will admit I was not one of those people. I got very, very sick after my second vaccine or my second vaccination, but it was very self-limited and I was okay afterwards.
Thanks for that. And so my next question is, should patients postpone other types of vaccinations? Is there a wait period before you can get the COVID-19 vaccine? Let's say if you recently received another type of vaccine, such as the flu or any other types of vaccines.
Yes, and actually currently the recommendations for all three vaccines, whether it's J&J, Moderna, or the Pfizer vaccine, because we really don't have at this time any safety or efficacy of this vaccine being administered simultaneously with other vaccines, the CDC is currently recommending that, you know, try and space everything by a minimum of 14 days. So if you've gotten one of your other vaccines, just wait 14 days to get your COVID vaccine. Now, many of my patients get concerned because they think they're going to lose their spot, right? They've been waiting for so long to get this vaccination and now they have to wait another 2 weeks. And I tell them, look, you've got your spot. You just schedule the vaccine for 14 days, but you know, this is what the recommendations are. And they're going to ask you when you get your vaccination, if you've had another vaccination within 14 days. Also, the recommendations are, and you know, that from the CDC are that if there's some kind of urgent need to get these within 14 days of each other, yes, that's fine. Medical necessity should take precedence. But I think by and large, we should just be spacing them out by 14 days.
That's good advice. And do patients need to quarantine after receiving the vaccine?
No, you do not need to quarantine right now, but after you get the COVID-19 vaccine, but you do need to remember that you are not fully immunized for a number of days afterwards. So with the mRNA vaccines, even after the first vaccination that you get, you're not at that 90–95%. You are maybe close to 50%, and that's still a couple weeks after that vaccination occurs. And with the J&J vaccine, the data that they showed at the FDA hearing indicated it was at least a week before you started to see that sort of separation between people who are vaccinated and people who are not. So really the recommendation that you need to follow isn't that you need to quarantine. You're not actively shedding anything here that's going to make anybody sick, but you still need to wear a mask, wash your hands, and socially distance because you still are at risk for getting sick with COVID. And we have had instances where people have gotten the vaccination, maybe their first dose of their vaccination, and still gotten COVID afterwards.
And I wonder, are there any studies looking specifically at the effects of the vaccine among IBD patients?
That is an excellent question. So they were not targeting any disease state in any of the clinical trials, although having a underlying disease was not an exclusion criteria. The clinical trials really did want to try and get as general of a population feel as they could. But there was not enough signal for any one disease state for them to look at. However, and it's great that you're asking this question because I should not be the one sharing this news. I think that Dr. Millie Long and Dr. Michael Kappelman should be sharing this news, but the Prevent COVID study, this is headed by Dr. Millie Long and Dr. Michael Kappelman at UNC, University of North Carolina, using the Foundation's IBD Partners cohort, is now going to be looking at the effect of the vaccines among our IBD population. So if you are interested in getting involved, and I encourage all of our IBD patients to please get involved, you can go to the Crohn's and Colitis Foundation website. You can sign up from there. And I just encourage everyone to please do it. Additionally, I know that Dr. Long has been conducting survey studies of patients about their concerns about the COVID vaccine, how they feel about the COVID vaccine, and just their concerns about COVID in general. And so even though we don't have clinical trial data from these vaccine trials, we are incredibly lucky that the foundation has been supporting some of this really great research specifically for patients with inflammatory bowel disease.
So before we get to that participation, I guess patients need to get it first. So how can patients get the vaccine now?
That is the million-dollar question, isn't it? First of all, it makes me happy to hear the people that when people say, I want to get this, when can I get it, or how can I get it? That makes me happy. The more frustrating news is that every state has rolled out their COVID-19 vaccinations a little differently. So the short story is you need to go to your state's Department of Health Resources to determine what are the criteria for your state, where are they on the prioritization protocol for their state, and see when you are eligible. That much being said, there are two resources that I know of that can help people find a COVID vaccine near them. The vaccinefinder.org can help you find where there's a COVID vaccine that's near you. And I know that NBC News had a plan your vaccine where you could put in your state, you could put in your age, and in like underlying medical conditions, and they would sort of let you know when you would be eligible or where you would fall according to the state's guidelines that have been issued so far. And it's tough because I live close to 3 different states, right? There's Delaware, there's New Jersey, and Pennsylvania, and all of them have different criteria for who gets the vaccine. And certainly there are people who say, well, if I was just over there, I would be able to get it. But please wait your turn. There are real reasons why the states have prioritized, and they're trying to roll them out as fast as they can. And we have seen a huge record numbers of people getting vaccinated. And now with this 3rd vaccine, it makes even more possible. So wait your turn in your line. It's coming close, coming to you, coming to a place near you, I promise.
Great. And for those there are people that are probably joining us now or later on before we talked about this, but tell us a little bit or kind of underscore a little of the information about the variants. So we're seeing that these variants are coming up, popping up on COVID-19. So how does that affect the effectiveness of these vaccines? Like, what can we do? What are some recommendations?
Well, that is the news now, right? These variants. So as a reminder, SARS-CoV-2, that's the virus that causes COVID, its entire job is to mutate and survive and to spread from person to person. And so there have probably been a lot of variants out there already. And what I'm going to talk about and the data I'm going to talk about, I want to give full credit to Dr. Eric Topol. He's a professor of molecular medicine and the director of Scripps Research. And this was data that he had compiled as of March 3rd. But the 3 big variants we hear about are the UK variant, that's the B.1.1.7, the South African variant, that's the B.1.351, and then the Brazil variant, that's the 501YV3. I think I got those all right. And we actually know a lot about these variants, including exactly where the mutations are, because we have the entire genetic code for SARS-CoV-2. And so we can see exactly where these mutations are. And again, there are a lot of variants out there, but the reason these stand out right now is that they encode mutations that have changed how the virus acts now. And it's become something that we can measure. We're seeing prevalence globally and in the United States. So let's go down these one by one, and then answer the million-dollar question: how do the vaccinations work? So the UK variant is the most prevalent worldwide, and the reason it is of concern to us is because there's also the highest number of cases in the United States. As of, again, March 3rd, there were 46 reported cases. That's very likely an underreporting, because we haven't really done a great job about sequencing SARS-CoV-2 and people who are positive here in the United States. We really don't know how many people actually have this. But we do know what's important about the UK variant is that it increases the virus's transmissibility, how quickly it can spread, how quickly it can transmit. And it actually does it quite a bit. It's like a 50% or greater than 50% increase in this. And that, it's not that it's more lethal, but when you increase how many people get sick or how many people get it, you are inevitably going to have more people who die. And so that is a big problem here. In the South African variant, as again, March 3rd, there were 48 countries that had reported it. And in the United States, we had like 17 cases. Again, very likely an underreporting. That one does not appear to have changed the transmissibility, and it's unclear if it's more dangerous variant. And finally, the Brazil variant is the least common, both worldwide and in the United States, 25 countries worldwide, 5 reported cases. And we again don't know if how this mutation has affected how easily it's transmitted or made it more lethal. But the million-dollar question is then, how do our vaccines work against all of these different variants? And we're still learning about this. What we know for sure is that it appears like all of the vaccines we have still prevent severe disease from all of these variants. And I think that's the most important message. We do know for certain vaccinations, certain vaccines, that they do have a change in their efficacy. So overall, the vaccines appear to work well against the UK variant, and that, again, is the most prevalent one in the United States. But we know that the South African one is a little bit more worrisome, because we see that it has a bit more of ability to reduce the vaccine efficacies that we have been able to see. So, and we have a little bit less data with Pfizer and Moderna, again, because those trials were a little bit earlier. But I want to bring this back to the point I started with, which is that the whole point of the virus is to mutate, right? That's what its whole goal is in life, is to spread from person to person and mutate to make it more easy for it to spread. We make it possible for more variants if we allow the virus to spread more. So as much as we can do to decrease the spread, we can limit the potential for these variants. So yes, shots in arms, getting vaccinations, that's going to be one piece of this, but that's only one tool in the toolbox. It also means wearing a mask. It means social distancing. It means avoiding these indoor gatherings and large gatherings, and doing all of these things, even if your governor has said it's okay to do so. Please adhere to these, because this is what's going to help us mitigate more spread and more variants and get ahead of all of this. We're really in a race right now against this virus.
And I know the CDC recently recommended that people wear 2 masks for protection. So can you explain why, and should we be adhering to them if we receive the vaccine?
So that is a really, really great question. You learned a lot of things during this pandemic that you never thought you would learn. And so one of them was this analogy called the Swiss cheese model. So we all know a piece of Swiss cheese that has a lot of holes in that one piece. And you can think of our barriers to COVID, masks, even hand washing, even vaccinations, right? They all have limitations, holes, if you will. Nothing is perfect. A single piece of fabric is great, but it's not 100%. Staying 6 feet away is good, but the virus doesn't have a measuring stick. It's not going to care if you're exactly 6 feet away or not. And even our vaccines are not 100%. But if you take multiple layers of the Swiss cheese and you layer them over each other, well, the virus could get through one hole, but you have just decreased the chance you've increased the chance it's going to hit a barrier when it gets through that hole from the next layer that's there. And so you have increased the possibility that you will still have protection, even though you know that there are limitations to any single barrier. And so the same idea is how I think about this double masking. We know that our masks are not 100%, but 2 masks over each other further limits the possibility that something gets out or that something can come back in. And this is really important with this UK variant because we know that it has, at least this 50% increased transmittability. And so you may not need as many exposure to as many virus particles to get sick. And so the more layers and the more protection you have, the better and the safer you're going to be. And so, you can wear it. I've seen people wearing the 2 masks, and I think that's great. Also, what the CDC says you can do is have a mask. This is what I use in the hospital and when I'm seeing patients in the clinic, that has 2 pieces of fabric and it has a pocket between those 2. And I put in like a paper filter in between those as well. So essentially I've got 3 layers now that are there. And that works really well too. Basically, you're doing everything you can to decrease that transmission, that you're increasing the barriers no matter what little holes there may be in one layer. You've now got 2 layers or 3 layers and you're even more protected. If you have been vaccinated, and this is a great question because the CDC just came out with new recommendations for people who are vaccinated today. But in general, if you have been vaccinated, especially the first couple of weeks after your vaccine, you still need to adhere to all of these. And so, yes, they should be, the 2 mask sort of recommendation is universal. But now the CDC has some new recommendations if you are a vaccinated individual with another vaccinated individual, for example. The headlines make it sound like vaccinated individuals can go crazy, and it's very worrisome for me because I don't think that's what they're supposed to be conveying. But certainly there are certain situations where people who have vaccines do not need to necessarily wear even a mask once they've been vaccinated.
And if a patient has been fully vaccinated for COVID-19, can they start seeing their friends and family? Can they pass the coronavirus to their friends and family who aren't vaccinated if that's the case?
And that is, so let's start with, can they pass the coronavirus? Because I think it's a really important question and one we are still learning about. The clinical trials in humans didn't really look, for any of the vaccines, look at transmittability of people who'd been vaccinated and whether they could still carry the virus in their nose and their oropharynx and spread it to somebody else, even if they didn't get sick themselves, right? Could we just be carriers to somebody who's been unvaccinated? The animal studies and some of the preliminary data indicates that probably it's a lot less than we would expect, but it may not be 0. And so that's what brings us to the new guidelines from the CDC that just came out today and are all over the news. So the short answer is, if you are fully vaccinated, you've completed both doses of the mRNA vaccines or that 1 dose from the J&J, and you've waited the appropriate amount of time after the vaccine, the short answer is yes, you can see your friends under certain circumstances. So what can vaccinated people do? They can visit other vaccinated people indoors without masks or physical distancing. They can be indoors with unvaccinated people from a single household as long as those unvaccinated people are not high risk for severe disease. I think this is really important. We do not want to spread virus, even if it's a very little virus, to somebody who's so high risk that even a little virus would make them very sick or could kill them. And the CDC recommendations say that if you have been fully vaccinated, you can skip and been exposed to someone who has COVID-19, you can skip quarantine and testing as long as you remain asymptomatic, but you should still monitor for those symptoms within 14 days and get tested if you do have symptoms. But it is not a free pass. Vaccinated people still have to take precautions in many scenarios. So you must wear a mask and socially distance among unvaccinated folks who are at increased risk for severe COVID. Or if you are seeing unvaccinated people from multiple households, and if you're seeing an unvaccinated person who is a household member with somebody else who has got a high risk for getting COVID. Again, we're trying to prevent this chain of going on. And we need to continue masking, physical distancing in public. in medium, large-sized crowds, in poorly ventilated public spaces. And again, if you feel sick, you still should get a COVID-19 test. So there are certain, I think, freedoms that vaccinated people can get, but I don't think it's a free pass yet. We're not there yet, but we're getting there. There's a light at the end of the tunnel. We are getting there. Nope.
I was just saying, we're hopefully walking all towards that tunnel. And unfortunately, that's all the time we have for tonight's chat. So Dr. Bewtra, thank you so much for your time this evening and the helpful information you've provided. Do you have anything else you'd like to add?
If I have 1 minute, I want to just say today is International Women's Day. And I want to send a special message to the women in our IBD community. So first of all, for our IBD moms, whether you are a mom with IBD or a mother of someone who has IBD, I just want to say you're amazing. And I know it doesn't always feel that way. In fact, you probably often feel a whole lot of guilt that you are the worst mother in the entire world, but please know your kids are going to grow up to be the same annoying teenagers as everybody else's kids are. And they're going to be even luckier because you did carry around all this worry and this guilt. And then secondly, to all the women IBD doctors and researchers and scientists that we have, it has not been an easy road at all, balancing all the responsibilities we have plus your job, and especially during a pandemic. And I was reminded of a great quote today that quote said, Cinderella never asked for a prince, she just asked for a night off and a dress. So I want to say, especially to these women doctors and researchers and scientists in IBD, thank you so much for your untold, unsung, underreported effort, work, caring, leadership, and support. And to everyone, we're going to get through this pandemic and get to that party as quickly as we possibly can.
Great words. Thank you so much. And so we hope tonight's chat answered all of your lingering questions about the new COVID-19 vaccine. And we will continue to update our website to provide you with the most up-to-date information. You can find this program and all of our COVID-19 resources, including vaccine information, at our website at www.crohnscolitisfoundation.org/coronavirus. And I again want to give a big thank you to Dr. Bewtra for joining us tonight's chat and all of the work she does to help educate patients and caregivers. So we're so lucky to have you on our side. Thank you so much. And if you have any questions that weren't answered today, again, I want to encourage everyone to contact the IBD Help Center at info@crohnscolitisfoundation.org or call 1-888-MY-GUT-PAIN. Have a great evening, everyone. Thank you. Be safe.
Thank you.